Welcome to the Medical Marijuana and Wellness Series. Today's topic is a safe semaglutide weight loss program. And with me is Turner Davis from the New Horizon Wellness Clinics. Turner, welcome.
Yeah, hi Mark. Thanks for having me. Good to be
Great.
here today.
You've put together a very safe program, and I'm gonna underline the word safe because there's a lot of talk about semaglutide and a number of other things that are out there. I think the key is really to have a professional work with you on your diet to really get the benefits from it. Is that correct?
Yeah, no, absolutely. Just a little bit of background on me, as far as why I'm comfortable, covering this information today. I am a pharmacist. I've been a pharmacist for about 20 years. So, medication safety and patient safety has always been one of the big things, big focuses of my career, obviously as a pharmacist. And when we talk about a safe program, we're really talking about having the right resources and the right communication, enough communication with your provider to be able to answer those questions and get you help you achieve your weight loss goal with help in the safest way possible with the fewest side effects possible. That's really what the overall goal is. So
Right. And that's really important to really find out. So Turner, what is semaglutide?
semaglutide is a was discovered well, they started working on it in 2006. It was a molecule that they were looking at the way the body felt hungry and the way that it processed food once we ate and things like that. And what they found was there was a particular hormone that was responsible for the body feeling full after you eat and gastric emptying, which is it's how long the food sits in your stomach and those sorts of things. So they decided to come up with a molecule that really mimicked the behavior of that particular hormone, and that's what semaglutide is. It's a molecule that Novo Nordisk came up with that really simulated the action of this particular GLP-1 hormone in the body, and they found over time that it was very successful, very effective for weight loss, and as we see things evolve and the drug being used in more and more people, it's effective for a lot of things other than weight loss as well. So, and then again, originally it was used for diabetic patients, specifically type 2 diabetic patients, not type 1, as a as an alternative to insulin therapy, and help those patients control their blood sugar, in a different manner than just the oral medications that were out there. So again, it's that they started working on this in 2006. It took, as most medications do, about 10 to 15 years for approval, and then in 2017 it was approved for use in diabetic patients, and it's been sort of taken off like a rocket ever since. The big advantage of the semaglutide, as opposed to some of the earlier drugs, was that it did only have to be injected once a week as opposed to daily. They're working on, improving that to monthly injections or an oral version of the medication. But right now, pretty much all of these types of medications are weekly injections that have to be given subcutaneously. So.
Sure. And semaglutide also has some other brand names. In other words, it's a kind of a generic drug, like Ozempic, Wegovy are two of them that are very popular that are out there.
Yeah, exactly. Yeah, no, they several of the different drug companies out there, once one got approved for it, they all sort of jumped on board and made their own versions essentially. So, that's sort of semaglutide, like you said, is a generic term. The name for the generic molecule are for those name brand drugs like Ozempic and Rybelsus and Wegovy and those things that we see so many commercials for on TV now, for sure. So.
Right, right. And it's fairly effective. So why, when I diet and exercise, why was I not losing weight?
Well, there's a lot of reasons for weight gain, and really what we've discovered over time is that a lot of it has to do with our diet and the way our body processes a lot of these high dense calorie foods that we eat, these ultra processed foods. Our bodies just really aren't designed to handle these highly processed foods that we eat now, that really cause big spikes in our blood sugar. It basically wears our pancreas out, and our body is always producing insulin to control this increased amount of sugar that we get on a day-to-day basis, and it really causes metabolic challenges over time. Our bodies become less the insulin that our body produces our bodies start to respond less and less to it. When we hear the term insulin resistance, that's what that is. It's, our body's been pumped so full of insulin for so long, trying to control our blood sugar, that we don't respond as well as we once did over time. And that really can cause weight gain. It can cause a lot of other factors as well. From an increased blood sugar standpoint. So really, it's about you know, we all know that diet alone or exercise alone really won't is not the main driver of weight loss. If we're on a weight loss program, it can certainly has its benefits, but as a weight loss uh, uh, standalone, exercise isn't enough. We really have to control our diets. We have to control the way our bodies respond to the food that we eat, and that's really where these medications come in. They help our body handle the food that we eat in a much more efficient manner, in a manner that lends itself to lower weight gain over time. So.
Sure. And as it says here, it's, your body is not necessarily metabolically healthy. It really is not in what I call a homeostasis mode with respect to your metabolism. It's not that you're
Yeah,
diabetic,
no,
or maybe you are diabetic, but you're just not in that. It's just not processing it the way it should be.
no, exactly. If our bodies, um, can't handle the amount of sugar, or not processing it efficiently or properly, then it basically stores all that as fat, and that's what we want to avoid. We want to have our bodies use that energy we're putting in and not store it because it doesn't know what to do with it, and that's sort of where a lot of us are a lot of the time with the diets that we have.
Sure. So you were talking about that particular receptor. Really, semaglutide is a peptide. Tell me a little bit about that.
Yeah, peptide or hormone, or they're all peptides, are basically large molecule enzymes in the body that cause a particular therapeutic effect. And most drugs target certain receptors in the body, and the receptors that this particular drug, semaglutide, targets are the ones that the GLP peptide or hormone work on naturally in the body. And again, the GLP-1 is something that our body produces naturally that again makes us feel full. It will help our it kind of times our gastric emptying, how fast our food goes through our digestive tract. And so what we found over time, again, that with this high calorie food, these large amounts of calories that are the American Western diet now that we take in on a day-to-day basis, um, you know our bodies again aren't responding well enough to it. We don't feel full, or we may be hungrier than we should be. And again, a lot of that has to do with the way our body responds to sugar, and it's a complex system. But at the end of the day, what the goal with semaglutide was to provide our body a boost to that GLP-1 hormone that we naturally produce. So it basically assists that in enhancing its effects. So, we're able to suppress the appetite more by using this particular drug, the semaglutide, because it tricks our brain into thinking that we're full, because it's again a hormone that our stomach produces when we are full after we eat, but maybe not
Mhm.
enough of it, or maybe our bodies aren't responding well enough to it, which is why we can supplement it with semaglutide.
Sure.
The slowing the gastric emptying, obviously, if this food sits in your stomach longer, you're going to feel full longer, and that's sort of the goal there. And then, as well as just helping the body, all of those things give the body more time to process the food and the calories and the sugar that we take in. So really reducing those big spikes of insulin that our body produces is really one of the goals there, and it'll help reduce the insulin resistance that occurs over time as well.
Sure. Sure. So, and let's take a look. So let's talk about studies that have been done. I mean, this is something that's been studied quite a bit.
It has, and the sort of unique thing about semaglutide is that were so many people so quickly that began to use it. So we really are getting large numbers of patients that we can see outcomes on a big scale, which is sometimes takes a lot of time, especially if it's a medication that may not have a lot of use, or a very specific condition. But something like diabetics and weight loss, I mean, that's a huge percentage of the population. So we're getting a lot of patients using these medications, and we're getting a lot of good data and seeing, how not only can the semaglutide help with weight loss and diabetic control, but we're finding that the anti-inflammatory effects of the drug which again I think go hand in hand with controlling insulin and amounts of blood sugar, the amounts of sugar in the blood. Those spikes that can really cause a lot of inflammation over time. I think more and more evidence shows that a lot of our chronic medical conditions go back to chronic inflammation and inflammatory conditions. So
Sure.
what we're seeing is that the semaglutide is actually improving outcomes in other types of uh, other types of disease states that have an inflammatory component,
Mhm.
or that may that our metabolism may play a big role in. One of those is in that they have looked at is in stroke patients. Uh, they found that those that took the semaglutide for over 3 years had a 20% lower risk of heart attack, stroke, and cardiovascular death. Again,
Wow,
that
that's
goes
pretty
back
cool.
again to inflammation of the blood vessels, buildup of plaque, and inflammatory conditions like that. So, that's something that they're looking at, and they may get future approval, these drug manufacturers, for other conditions. Right now, that would be an off-label use, but the clinical trials are very, very positive for sure.
Yeah, it's providing a lot of positive benefits, besides just the weight loss and,
Mhm.
and diabetes control. And again,
Exactly.
the
Exactly.
question is it safe? I think this has to do a lot with the trials that are out there. They've done, what, 5 different trials or something like that?
Yeah, no, exactly. And anytime we talk about safety of a drug, we look at the risk to benefit ratio of that drug, right? Does it do more good than harm? And what we're finding is that the semaglutide is has many more benefits than potential side effects, as far as percentage of users and percentage of population that use the medications. Because again, there's so many chronic conditions, there's so much uh, comorbidities with obesity and being overweight, and living in a constant state of inflammation because of high blood sugar and things like that, that it really is a dramatic uh, benefit to lose to be able to control weight in a healthy manner, for sure. What the study showed as far as the clinical trials for approval, and these were the ones that they looked at, the drug companies did to get the approval for weight loss, was that from baseline to week 68, they saw a 15% a weight loss in the semaglutide group, as opposed with only 2.5% with placebo. So that's a pretty strong correlation, obviously, statistical correlation between the use of the drug and the weight loss. And so what they found basically was that, at the maintenance dose of 2.4 milligrams, with lifestyle intervention, obviously you can't, I've heard one of the terms that you hear is some patients eating through Ozempic. So, you take it, but then if you increase the amount you eat rather than decrease, that doesn't really help. You do have to listen to your body, and if you feel less hungry, then eat less, and those sorts of things. But what they found with lifestyle intervention was sustained clinically relevant reduction in body weight, so which is the goal.
Yeah. Well, like all weight loss programs, this isn't a one-trick pony. You've got to not only use this, but you've got to go in and also do that diet and exercise. And we'll talk about it in a minute, but you
Yeah,
put it together
absolutely.
with a weight loss program and it's effective. What are the
Yeah, no,
side
absolutely, exactly. And again, we'll talk about it in a minute, but one of the big benefits of semaglutide is that you don't have to make dramatic uh, dietary changes, really. For most patients, if you eat a moderate amount, or eat even just a little bit less than what you were currently eating before, you can see a pretty dramatic weight loss difference. So, but side effect profiles, like we mentioned, when we're talking about risk benefit, we do have to look at potential side effects of every medication. Certainly, when you start, the way semaglutide is dosed, you start at a very low dose of 0.25 milligrams, and you work your way up to the maintenance dose of that 2 to 2.4 milligrams. Not every patient will get that, reach that maintenance dose of 2 milligrams. Some patients can lose weight on 1 milligram or 1.5 milligram, so it all depends on the patient. Uh, but for as far as the side effects go, the main ones that we see are the GI side effects, some abdominal pain, nausea, vomiting, constipation, diarrhea. Very common with a lot of medications, but particularly ones that affect the GI system, like semaglutide does. So, for example, if the delayed gastric emptying that occurs with semaglutide, which is what we want to see, which is one of the goals. But it can, if you overeat or overindulge in really fatty foods and things like that, nausea and vomiting can certainly occur. So it does. You do have to be conscious, really, of the amount of food that you eat and the types of food that you eat, as far as if you're having those sorts of side effects, those changes in your diet can help that a lot. Nervous system, fatigue, and headaches, again, very common with most medications. And because it is an injection, you can get injection site reactions, which are rare because it is a subcutaneous injection, not a IM. So it's a very small needle and a very shallow injection. So more serious side effects include, gallbladder problems, hypersensitivity, which allergies are always a concern with any medication. Pancreatitis, gastroparesis would be the two most serious that we see with in the data with semaglutide, but those are very rare and usually dose related. When we see those serious side effects like that, it's typically because a patient has started off on too high of a dose. You do have to let your body adjust to the medication, and starting off with too high a dose can certainly cause more serious side effects. So.
Yeah, dosing can be your poison. That's really the key that's really there. So who actually is eligible to take semaglutide? Who should be looking at doing this?
So, it's a very broad range of patients that can potentially benefit, but there are some contraindications. Obviously, it's only approved for adults, so only 18 years or older. Pregnancy or breastfeeding, really, with any hormone type medication, you really want to avoid pregnancy and breastfeeding while taking it. Type 1 diabetics, this is not an insulin. This is not a medication that type 1 diabetics would tolerate very well because it could cause hypoglycemia potentially with those patients. So we do want to avoid it in those patients. Again, any allergy, hypersensitivity, you would want to avoid. In rare cases, there has been some correlation or some issues with patients with a history of thyroid cancer. That would be something that is also a contraindication, or the rare or multiple endocrine neoplasia syndrome, which is again very rare. Pancreatitis, since it does affect the pancreas and your insulin production, pancreatitis would be a contraindication. And then end stage renal disease, and we say end stage, that's the very end stage. If you're on dialysis, obviously you wouldn't want to be taking a medication like this. And a BMI under 25, so you have to be overweight to qualify for this medication. So this would not be a first line therapy if you have 5 pounds to lose. You really, Ozempic or semaglutide would not be your first line treatment at that point. You would want to, this is for patients that are clinically overweight, which would be BMI over 25 and typically over 27 for most patients before they began this medication. And you can continue to take it if you drop below that, but starting it as a new therapy, the literature does want to see, good medical education for that. So.
But that's who shouldn't take
Um,
it. Tell me who should.
Well, really, it's for pretty much anyone else that's not contraindicated for it. There are some patients that we do want to be, a little more uh, conscientious of it and work with their primary care provider if they are interested in using semaglutide. Patient that has type 2 diabetes, if you're working with a weight loss clinic, they're not going to be typically managing your entire uh, diabetic regimen. So you would want to work with your primary care provider if you do have type 2 diabetes and taking other medications for that. Patients with diabetic retinopathy, would be again, work with your primary care provider. Or if you have uncontrolled hypertension or serious hypertension problems, you'd want to work with your doctor as well. But really, for everyone else, they can, using program like New Horizons program for the weight loss specific use of semaglutide. It's really, again, shown to be effective, fairly low risk outside of the typical side effect profile that we just talked to, and can really be prescribed by any type of provider there. And really, it's just a matter of finding a good program and a program that will support you throughout your weight loss journey there.
Yeah, and that's really key to find someone who's there and who can support you. That's really the key.
Exactly.
What
Exactly.
other keys to success? Like what should you eat and how do you work out?
Well, it's again, the more of a program, a full program and this is really true with any weight loss program. The more well-rounded the program, the more benefits you're going to get out of a particular weight loss medication. So really, working with a reputable weight loss professional, a medical provider is key in these situations. You do want to be able to ask questions and get good advice. Uh, and again, having the dosing correct. Start low, go slow. Start at the lowest recommended dose of the 0.25 milligram, and then work your way up to the maintenance dose through the proper amount of time. Rather than having someone push you to lose more weight quickly, which can cause more side effects and more serious side effects. You do want to use it judiciously and as recommended uh, through a medical professional.
And
Um,
losing about 1 to 4 pounds a week is probably a good goal. I think you have to be really realistic, because you start losing too much
exactly.
weight, when you quit, it's going to all come back.
Yeah, we say a half pound a day really is sort of the sweet spot where you want to be for weight loss. Which would be around 2.5 pounds a week or something like that. So yeah, that 1 to 4 pounds is well within the mark, and again, you'll hit plateaus. You may not do that on every single day that you've ever been on the medication, and there'll be maybe a week or two. And this is true with any weight loss program, that your body sort of takes a minute while it's adjusting, and you don't lose much weight. But then again, if stick with it and stay on the course, and you'll start losing weight again with after you pass that plateau period.
Yeah. And
Nutrition
like
obviously
any other
important.
diet, you really want to do things like drink plenty of water, right?
No, exactly. But yeah, staying hydrated is key, and also, that also helps you feel full. By keeping well hydrated. So that's very important. Taking constipation can be an issue, especially if you change your diet dramatically or eat a lot less than you're used to. So, keeping fiber in your diet is important. Again, it also helps you feel full. Protein intake is very important. Obviously, when you start to lose weight, our body tends to like to shed lean muscle before it sheds fat, or in greater amounts than it sheds fat. So you want to support that muscle as well as you can with good lean protein and some exercise as well. You want to avoid fatty, fried, or spicy foods. I think from a weight loss perspective, obviously, but also from a GI side effect uh, perspective, the more uh, the fattier the food, the more nausea and things like that will typically occur with semaglutide use. Nightshade vegetables, there we have a list of those in our documentation, but things like eggplants and certain types of peppers and things, it can just make the side effects a little worse than the GI side effects a little more prevalent than if you
Yeah.
avoid them. And minimizing the consumption of alcohol, again, with any weight loss program, that's going to be key. uh,
I mean, you can
I
drink
talked about
alcohol,
any
just do it in moderation.
moderation. Exactly, yeah, minimize it. Yeah, it's a source of empty calories, plus just it makes the appetite control that much harder as well. So
Sure. And then
but
the
actually,
workout
I talk
program, I think, is really important. I think, walking, maybe 4 to 6 times a week, at least 30 minutes, really makes some sense, and some strength works out, right?
No, absolutely. Well, I mentioned eating the protein, and those that exercise program will help you maintain that lean muscle as well. It's not something I always recommend to patients when they start a weight loss program, that you don't want to jump out and do everything at one time. Typically, not working out for the first month or so you're on this weight loss program, while your body adjusts and your energy level adjusts. There's nothing wrong with taking that time to let the diet really start and kick in and get used to it before you start exercising again. A lot of times patients will try to start the medication, start dieting and exercising all at the same time, and your energy level sort of crashes and you're starving to death, and it's so you really, or you feel like you are, and so you really want to, I always recommend take that first month, let your body adjust to the diet. You're going to lose more weight with the diet than you would even with exercise in the beginning, and you will be, your energy level will recover better, your appetite will stabilize more. So while it is important, while you certainly should work out 2 to 3 times a week, you don't necessarily have to do it from day one if you're not used to it, obviously. I mean, again,
Yeah.
if you've already been working out 2 or 3 times a week, please continue. But it's one of those things where if you haven't been, starting the diet and starting exercise at the same time can be difficult sometimes. But
Yeah.
it
And
is
and
over
this
time since.
program will work. I mean, you have to have
Yes.
confidence, and it will work. I'm taking it myself,
Yes.
and I found that's the case. But you've got to trust it. And what I mean by trust it
Exactly.
is, don't try to take too much too quick. In other words, stick to the
Yep.
dosing, because dosing can be your poison. because that's where you get into some problems with constipation, nausea, and things like that. And I think the other thing that's really important to pay attention to is that this is something that really is made to work with you as a person, your metabolism. It's very personalized. And that's why getting somebody to help you out is really key.
No, absolutely. I agree. I agree. And, and asking those questions of when can I, when can I start exercising, or I'm feeling hungrier than I should, or those sorts of things is something that having someone to ask that question to can really be the difference between being successful at a program and thinking it's not working as well. So it is definitely key.
Great. Now, let's talk about dosing because you mentioned that earlier. Um, Dr. Tina Moore comes out and says the issue is not the drug, it's the dose. And that's really true. Taking too much, maybe not taking enough, but especially taking too much causes a lot of negative side effects. And as it starts to work, your temptation is to up your dosage, but just be cool. Do your 1 to 4 pounds a week. And it'll get there. I mean, you will get there. But tell me about dosing for a second.
But yeah, no, again, the dosing recommendation for a new patient starting semaglutide is to start at the 0.25 milligrams, and then you increase every month, by about half to 1 milligram until you to reach 2 milligrams or 2.4 milligrams a week. But again, not every patient can tolerate that. Some patients have more side effects as the dose goes up. And for a lot of patients, it's not necessary to increase to the maximum dose to continue that weight loss.
Sure.
So, for example, we may increase a patient from 1.7 milligrams to 2 milligrams or 2.4, and all of a sudden that patient starts having a lot more GI side effects. So we can always back that back down, and that patient can maintain on 1.7 or 1 milligrams, whichever, and still lose weight and still be effective. So again, it is individualized that way as far as how patients react to the medication. For the most part, most patients can tolerate the maintenance dose just fine. But if you can't, that doesn't mean you have to reach 2 milligrams. You can be just fine on 1 milligram and still lose weight and still have success with the program.
Yeah, and that's really
Um,
key. Everybody's metabolism is different, and really what you got to find is your sweet spot.
exactly, exactly. So no, there's nothing wrong with that at all. Some things that can occur over time. There's been a lot of articles out there about Ozempic face, or things like that. Again, anytime you lose fatty tissue, it can cause changes in appearance. But again, it's unusual, and typically occurs at higher doses over longer periods of time. And the more rapid the weight loss, the more issues that can occur. So again, keeping the dose at a reasonable level and keeping your weight loss at a reasonable rate uh, avoids a lot of those issues as well. It gives your body time to adjust in a healthier manner. Um,
And I think an important thing to point out is in normal weight loss programs, you will plateau. You'll get to a point where
yes,
maybe
absolutely.
3 or 4 days you'll have the same weight. Although on the program, I think you recommend weighing yourself once a week so you don't get hung up with this plateauing. But your body's just adjusting, and then your body will adjust, and it'll go back into the weight loss program.
Yeah, exactly, exactly. Just some additional things just to mention. We mentioned the medullary thyroid cancer being a contraindication. The reason for that was animal studies showed that there may have been an increased risk of developing thyroid tumors, but we've not seen that in human beings yet. But again, that information's out there, just so being cautious. That's why that contraindication is there. Gastroenteritis symptoms, again, that is very common, but something that needs to be monitored. And if they get too severe, then it may be necessary to lower the dose dramatically or stop the medication altogether. But we don't. That's unusual. That patients can't tolerate it at all.
Sure.
Rapid weight loss, hair loss with weight loss programs is something common. We see that a lot. We often recommend taking a supplement, a biotin supplement or something like that if it becomes an issue. Again, that's typically just the body reacting to the loss of nutrients and things like that. And then low blood glucose is it can happen, but it's very rare if you're taking semaglutide alone, because it's not really directly affecting the insulin production and those sorts of things. It's more of helping your body produce the right amount, not actually directly influencing how much is produced in the body. So we don't see those same types of issues. So, there are just a couple of other things that are in the literature that just wanted to mention. So
And I know that in preparing for this webinar, I looked at a lot of YouTube videos, and I have to tell you, they're so contradictory, and there's so many things out there. I came to two conclusions: listen to the doctors. There's a lot of
yeah,
people
no,
out there who
exactly,
want to talk about
exactly,
what they did, and in many cases, they didn't follow the dosing correctly, and they didn't follow a
right,
doctor's instructions. They got themselves
right.
some issues. I think when you follow
The,
the doctor's instructions, that's important. And I think the other is it's okay to adjust the formula up and down. In other words, if something's happening
yes,
that's causing a negative side effect, you're
correct.
for example, at New Horizon and New Horizon Wellness, you'll actually adjust the formulas down, right?
Yeah, no, absolutely, absolutely. We listen to the patient. We listen to we really listen to how they react to the medication, and yeah, no, we're not locked into one particular dosing regimen at all. It's very patient specific. So
Yeah, very individualized, and I think that's really the key. It's individualized for every individual. So Turner, tell me about the programs for that New Horizon has for weight loss.
yeah, so we decided to offer two different tiers of programs. We've got one that's a little more cost conscious, and another that has a little is more services, but is a little more expensive. The medical only program would be our lowest cost alternative, and that's really focused on providing the semaglutide to a patient for use with the lowest possible cost. You'll get monthly follow-ups with a provider on this one to make sure that you're responding well to the medication and not having side effects. So the first 5 months, 1 through 5, is $250 a month on this program, and once we increase the dose to the maintenance dose, it does cost us a little more money than the lower doses. So we do have to increase the price to $350 a month for maintenance. So that's sort of the structure of that program. The full program we offer is for those patients that really want to dig in more to lifestyle changes and have some more support. So we'll have weekly telemedicine or in-person visits if you're close enough to a clinic. We provide printed resources to guide those lifestyle modifications and give you a roadmap on how to succeed best on the program. Medication and prescriptions are, of course, included in the price, and we also offer weekly lipotropic injections, which lipotropic injections are vitamin shots that can enhance weight loss in certain patients, and have been something we've offered at the clinics for a while, and we just wanted to make sure we offered that as well if interested in this program. So, that costs an extra basically $100 a month. So for the ramp up doses months 1 through 5, it's $350 per month, and then $450 per month once we get to the maintenance phase of the program.
Yeah, and I think it's important to point out that when you get to the maintenance dosing, both for the medical only and the full program, you're really getting a lot more product because at that point you're taking a lot more, and it's important that the price is increased because of the fact that you're basically getting more medication.
Yeah, exactly. Unfortunately, it is based on the amount of active ingredient in the product, the cost of these products, and we are using a significantly higher dose on those maintenance doses than on the lower doses for sure.
Now, let's talk about the cost comparison because those costs are extremely attractive when you compare it to the options that you see in the market.
Yeah, no, unfortunately, that's the nature of healthcare where that we live in. These new medications can be very expensive, and semaglutide and the name brands are no exception. They typically will range anywhere from $1,000 to $1,500 a month, depending on the type you get. These are we price these out at 6 weeks here. For a 6 week supply at CVS would be about 2,000 without insurance. If you have insurance, obviously, and your insurance will cover it, then obviously that would be the best option because copays can range anywhere from $25 to $50 for some insurance programs, but there are very few insurances that will cover weight loss medication, unfortunately, which has never made any sense to me. But that's because obviously, from a cost perspective, if we can avoid those chronic medical conditions over time, then from an insurance perspective, that would save them money. But unfortunately, they consider these cosmetic or cosmetic treatments or cosmetic medications, so they won't a lot of times they won't cover them. So for, I would say probably somewhere between 10 to 15% of insurances cover these, and the rest, and about 85% don't.
Yeah.
And then we're left with a cash out of pocket price, which is where we come in at the 250 for a month for the cost that we're able to provide that uh, for that rate.
Yeah, and comparatively, the 250 or the 350 a month is a much better deal, and plus you get the support. I think that's the important thing to point out. Having the
Exactly,
support is
exactly.
crucial
And
to make this thing work.
exactly. And in the medication, the semaglutide that we provide comes from, FDA approved compounding pharmacies. They're called 503Bs. The FDA has to go in and check them out, and on a regular basis. So, these pharmacies that the medication comes from is what they call compounded at the pharmacy. It's the same active ingredient as in the commercially available products, but it is a lot more cost effective from a cash perspective, especially. So.
Sure. Great. Well, Turner, where do we find you?
Well, so we've got several physical locations listed there: Jacksonville Beach, Tallahassee Villages, Winter Haven. I encourage, any of those patients that are interested or in those areas to come and visit us in person. But most of our clinic visits occur online. Telemedicine is available all over the state of Florida. So, again, visit our website, newhorizonclinics.com. You can schedule an appointment, fill out a questionnaire online as well to see if you're a good candidate for the program. So we look forward to hearing from you. We're excited to offer this as a program for our patients, and we look forward to hearing from everybody.
Sure. And I think the telemedicine makes it available to really anybody in the state of Florida that really wants to
Anywhere
use
in
it. You can
Florida,
do it with a
absolutely.
professional program that's going to help you really get something tailored to getting this done. I know that's the key. Lots of weight loss programs out there, but what works, and more importantly, after you stop, what continues to work? That's your
Exactly.
desire.
Building good lifestyle habits is absolutely key, and the semaglutide can assist with that. But like you said, it is important to continue it whether you're taking it or not. So.
Okay. Good. Well, Turner, thank you very much. Fascinating program, and I really encourage everyone that's looking at losing weight to get a hold of you. Thank you very much for watching. And Turner, hopefully we get some new patients that help with their particular health situation.
Thanks so much, Mark. Appreciate
Thank
it.
you.